The next presenter is Dr. Hope I get this right, Dr. Thomas Fincke, LSU Physical Medicine and Rehab PGY2. He'll be speaking about the Superion Vertiflex Superion, I believe, in quality of life. So take it away, Thomas.
Yes, sir. Can you hear me?
Yes.
Okay, great. Thank you for giving us the opportunity to present myself along with my mentors, Dr. Randy Zoid, Dr. Casey Murphy, and some nursing colleagues, Jonathan Santa Cruz and Arnett Giles. We manage a lot of patients in the interventional pain department that have chronic lower back pain with neurogenic claudication. A select portion of this population are not good candidates for open decompression. And we noticed a paucity of non-industry funded data on the safety and efficacy of interspinous process decompression devices, especially in the veteran population. So we designed this IRB approved prospective case series with the involvement and funding of the LSU Department of Research and LSU Internal Medicine Department to study the utility of these devices for improving quality of life in the VA population. So far, we've enrolled 14 patients. These patients have exhausted conservative measures and failed 6 months of treatment. Additionally, these patients are not good candidates for general anesthesia, maybe due to comorbidities, or they have personal reasons for not wanting to undergo an open surgical intervention. So Dr. Murphy, board certified PM&R and interventional pain specialist, performs the placement of these devices using IV sedation. The rest of the team, including myself, track the patient's pre-op and post-op at various points of time using an SF-12 survey as the established method to determine changes and measures of quality of life. The SF-12 is a self-reported outcome measure, and it assesses the impact of health on the individual's everyday life using a mental composite score and a physical composite score. Additionally, we assess positive outcomes by asking each veteran at 6 months and a year whether they would recommend the procedure to a fellow veteran with similar symptoms. We wanted qualitative data served by asking that question, as we felt the pain scores being more quantitative are sometimes not as effective of a measure, especially in the context of these chronic pain patients. So as it stands now, with 14 current patients, 79% of those patients reported an increase in the mental composite score on the SF-12, indicating a gain in mental health, and 5 of those 11 reported an increase of at least 1 standard deviation. 57% reported an increase in the physical composite score, indicating a gain in physical health. 3 of those 8 have reported an increase in that score of at least 1 standard deviation. Lastly, 68% have responded that they would recommend this device placement to a fellow veteran who's having similar symptomology. And 2 patients have not responded to the recommendation question as they felt more comfortable waiting until they were a year out. They felt uncertain at this point in time. And lastly, I just wanted to note that this is an ongoing study with further enrollment planned. Thank you all for having us. Appreciate it.
Eric, so your criteria for patient selection, what MRI, central stenosis primarily, maybe some foraminal stenosis, and then true neurogenic claudication, or just necessarily back pain, or?
Most of these patients have true neurogenic claudication, I believe all of them, with the central stenosis on MRI, and as well as ruling out things like osteoporosis and bleeding disorders that would cause safety issues.
Right, and then you selected them for also being poor candidates for open surgery, or simply not desirous, or were there any criteria on that side, or?
Either. So either comorbidities, they can't undergo general anesthesia, or they just personally, some of them do not like the idea of undergoing open operations,
Sure.
being more involved, more traumatic, a longer surgery, that kind of thing. So some
Sure.
of them was more of a personal reason. Yes, sir.
And then they can always proceed to open decompression. if that doesn't work to their satisfaction. It looks like the early numbers are good. It seems it's a nice procedure.
Yes, sir. I did mean to mention that it is reversible. You can remove the device, so that's
Yeah,
a great point, Dr. Roy. So thank you. Yes, sir.
sure. Great. Okay. Well, thank you so much for participating. Excellent topic. And a
Thank you.
really,
Thank you for having us.
and I do think it's a very promising treatment option.